Hello once again and welcome to this health information channel. It is Dr. Bosede Adikite on the program Clinic Annex. I did tell you that on Clinic Annex, I answer your questions to benefit the public. Today, I want to answer a question often asked by hypertensive patients. They want to know when they can stop their treatment. Really? You want to stop your treatment? Okay, please watch this video to the end so you know if you can stop the treatment or not. By the way, hypertension and high blood pressure are the same thing. I ask patients if they're hypertensive, they say no. And I ask if they have high blood pressure, they say yes. They are same and can be used interchangeably. Now, there are a few known causes of hypertension that once you take care of them, you no longer need treatment for hypertension. One of them is pregnancy. In a few women, hypertension complicates the pregnancy. They develop high blood pressure just because of the pregnancy. If they are delivered of their babies, then the blood pressure returns to normal. Within 3 months, everything settles and they no longer need our treatment. We call it pregnancy-induced hypertension. But if the high blood pressure lingers longer than 3 months, maybe in the fourth, fifth, sixth month, they still have high blood pressure, then that is not pregnancy-induced hypertension. The diagnosis was wrong ab initio. What they had was chronic hypertension. And for this category of patients, they will continue their treatment. Also, for those that have what we call secondary hypertension. In secondary hypertension, there's a primary problem, but hypertension complicates it. If you take care of that primary problem, then hypertension is no longer a problem in them. Example of that is drug-induced hypertension. In drug-induced hypertension, a patient develops high blood pressure as a result of a medication they are taking for the treatment of another medical condition. If they have taken this medication for a long time, they can then develop high blood pressure. But if you take away that medication, then their blood pressure can return to normal. Example of this drug is steroids. Steroids are notorious for this. So it is not only steroids anyway, but if you take away such drugs causing this high blood pressure, then such patients may no longer need treatment for hypertension. Same with thyroid dysfunction and some other causes of secondary hypertension. But let me quickly add that this constitutes just about 5% of cases of hypertension. The larger majority of hypertensive cases, that's 95%, have what we call primary or essential hypertension. In them, there is no known cause. They do have risk factors though, but taking care of the risk factors alone may not resolve the hypertension. So they need to be on medications and therefore their treatment is lifelong. Yes, you heard me right. Their treatment is lifelong. However, what are the reasons why our people want to stop their medications? I have interacted with many and they have told me reasons. First of such reasons is that they don't have symptoms. And that is true. Many hypertensive patients do not have symptoms in the beginning, and that is why hypertension has been called a silent killer. It just creeps in without giving you any warnings, and in time, it continues to damage the internal organs. And by the time you know, you are having symptoms not of hypertension itself, but of complications of hypertension. So it's already complicated. The heart has failed, the kidney has failed. By the time you are knowing, or somebody is even having stroke, some drop dead before people know that they had hypertension because they themselves did not know because they had no signs. They walked around and did their businesses uh, with very high blood pressure. So please let everybody know that you don't wait until symptoms develop before you treat hypertension. Secondly, some people say they were given a short supply of their medications and they have exhausted them. That is true. We used to give you a month or 2 months supply so that you can come back for reassessment. We want to check what your blood pressure is like when you come back so that we know what to do with your medications because we adjust the medications according to your needs. We can increase, we can reduce dosage, we can add medications, and we can withdraw medications. So please call me back for replenishment and reassessment. Also, some say they don't want to get addicted to the drugs. These drugs are not drugs of addiction. Nobody gets high or hooked by taking the medications. Some say they don't want to remain on medications for life. That is understandable, and I sympathize with you. However, if there's a medication that will help you to go through life seamlessly, wouldn't you rather take it? I think it is ideal. And the last one, which I think we should discuss really, is the issue of side effects. A lot of people say they have side effects. If you develop a side effect and it is life threatening, maybe you cannot breathe well suddenly as a result of the use of the medication, or your body starts itching, or your body becomes swollen, your tongue is swollen, then please stop. It is life threatening, go back to the hospital. However, if it is milder side effects you are having, maybe mild headaches, or urinating a lot, or your libido is beginning to be affected, please do not stop. Continue to take the medications and go back to the hospital to see your doctor. Your doctor knows what to do. Now, there are people who tell you that they can give you a one-off treatment, and once you take this medication, you no longer have hypertension. Your hypertension is cured. Really. Our medications do not cure hypertension. They control the blood pressure. So if there is a person promising you a cure, if you choose to go with them, it's your choice and it is within your right. But please be sure that you have not been scammed. Keep checking your blood pressure so that if you need to do something about it, then you go back to taking your treatment and following up with your doctor. And there are some that insist they must stop, they just want to stop. What do you risk? You risk developing serious complications of hypertension. I've mentioned them earlier: stroke, heart failure, kidney failure, and visual problems. These are not um, complications anyone wants to experience because they are irreversible by the time that they start. Some of them, hmm, they will come with irreversible disabilities like stroke. Imagine somebody that has a dense stroke. That person can no longer use two limbs on one side of the body. That patient may remain dependent on others for the rest of his life. So we don't want that. Please share this video with everybody. Let everybody see it. Somebody out there might have contemplated stopping their medications. Please, if they see this, they might have a change of mind and we would have saved their lives. So please share with everybody. Put your comments and your questions in the comment section so that I can treat them next time. Do not forget to subscribe to this channel so that you don't miss the educative videos that will be uploaded here. Thank you so much for your time today. Always remember that good health is great wealth. Until I come your way next time, please keep checking your blood pressure. And if you're hypertensive, keep treating the hypertension. Bye.